Nobody has it easy these days, not even actors and actresses. The one thing that keeps us all trudging along though is hope, whether that hope entails faith in a returning Messiah, dreams of fame or fortune, or just the anticipation of a hot meal at the local homeless shelter. Sometimes, though, we become so enamored with our own burdens that we lose sight of hope. Perhaps the following stories of brave, albeit unfortunate souls will help relieve these burdens by reminding us that things could always be far worse. The Ulaş family. This rural Turkish family has some sort of unidentified disease that causes them to walk on all fours and use primitive speech. Essentially, their bodies have developed in a way to resemble those of apes. Scientists still aren't sure as to what causes the family to do this, but there has been speculation of genetic causes. José Mestre. A Portuguese man, José had a large tumor that had consumed his face and made it hard to breathe. Eventually a surgeon in Chicago was found that would perform the risky operation to remove it. The Portuguese government paid for José's medical expenses, and he now lives a normal life. Pedro Byakatonda. Pedro comes from a small town in Uganda and suffers from Crouzon syndrome. This disease affects the skull, pushing the eyeballs out of their sockets. He eventually received life-changing surgery in Texas and now lives a much more normal life. Rudy Santos. While he was still in his mother's womb, Rudy had a twin. Unfortunately, his twin was absorbed into his body. Now he suffers from a condition known as craniopagus parasiticus or parasitic twin. Basically, he has an extra pair of arms and legs sticking out of his body. Harry Eastlack. The famous stone man, Harry had something called fibrodysplasia ossificans progressiva. In simple terms, his skeleton fused together, leaving him only able to move his lips. When he died in the 70s, he donated his body to science in hope of finding a cure. Paul Carrison. Paul has something called argyria, where the skin takes on a permanent gray-blue tone. It is caused by improper exposure to the element silver. Didi Koswara. Known as Tree Man, Didi is an Indonesian man who suffers from the rare fungal infection known as epidermodysplasia verruciformis. This condition causes hard fungal growths resembling tree bark to protrude from his skin. In 2008, he received treatment in the United States, but the growths came back. There is not permanent treatment for his condition. Didier Montalvo. Called Turtle Boy by his peers in Colombia, Didier has a disease that causes moles to grow all over his body at a rapid pace. One of the moles grew so large on his back that it looks like he has a shell. He was ostracized by his community until a British surgeon by the name of Neil Bulstrode flew to Colombia and removed the mole, allowing Didier to live a normal life. Tessa Evans. Tessa was born with something called arynia, which means she doesn't have a nose. Fortunately, people with Tessa's condition can have a plastic nose attached. When it comes to smelling though, Tessa will likely have to live a scentless life. Manar Magid. Like Rudy, Manar suffers from parasitic twin syndrome. Unfortunately, due to complications during a surgical attempt to separate the twins, Manar eventually passed away. Mandy Sellers. Afflicted with Proteus syndrome, Mandy has the same disease as Joseph Merrick. However, in Mandy's case, it primarily affects her legs. They grew so large that one of them even had to be amputated. Min On. Known as Fish Boy, Min has a strange condition which causes his skin to flake and create scales. Doctors believe it may be due to Agent Orange, a chemical used by the U.S. military during the Vietnam War. Lu Hao. Meet Lu Hao from Jiangsu. Since birth, Hao's left hand has been plagued with a ridiculously oversized thumb, index finger, and middle finger. This condition is formerly known as macrodactyly, and is a form of local gigantism. Hao underwent surgery at a Shanghai hospital in late 2007, during which approximately 5.1 kilograms of flesh and bone were removed. The Chinese Elephant Man. Pictured above is Huang Chengkai's, better known as the Chinese Elephant Man. He suffers from a form of elephantiasis that has over the years morphed into a giant 15 kilograms tumor so heavy that it pulls his facial skin downward. After a long and troubling life that has made it difficult for Huang to just sip on some soup, he was finally offered free assistance from the doctors at the Fuda Cancer Hospital in Guangzhou.